Hi, this module is going to deal with clinical data standards, both current and emerging. Although I would say all the ones we're going to deal with are current, however, some of them are more emerging in their adoption at this point. As with most of this course, there's no expectation that you memorize these. They are lengthy, detailed standards. Some are data architecture standards we're going to talk about. Some are transport standards. And as you go through your readings and your assignments and assessments, you'll understand more about that. Why standards? Well, I think most of us in the technical fields understand that standards are necessary to give any kind of quality or meaning to data. And as the efforts for interoperability are increasing, the standards become more and more important. The standards we're going to talk about are national and international standards, but there is another group of standards known as local standards. Local standards deal with small exchange groups who have agreed upon certain standards for the data or the package that the data is going to be transported in, etc. Local standards are very important to people. Most of the exchange that has occurred until the last few years has been based on local standards. Now, with the emergence of national standards and international standards, the push, of course, is to go to those standards whenever possible. Some of the standards we're going to talk about in this module, but not in the lecture per se, are the LOINC codes. Those are logical observation identifiers, names of codes. We're going to talk about DICOM, which is an imaging standard. CDISC, which is Clinical Data Interchange Standards Consortium, standards from them. EHR, Interoperability Connectivity Standards, that's ELINCS. Another one that's very important that you'll be talking about is SNOMED, Systemized Nomenclature of Medicine and Clinical Terms. And primary among all, and it's emerging in its use, although it's been around for a few years, is going to be the Consolidated Clinical Document Architecture and the documents that exist or templates that exist within, which is the CCD, the Continuity of Care Document, and the TOC, the Transition of Care Documents, and the standards that are associated there. You've also got the ICD-10 and 9. Right now in the healthcare world, people are making the transition from ICD-9 to ICD-10, and that's the International Classification of Diseases standard. You'll see a lot in the press about the difficulties in making the change from ICD-9 to ICD-10. And we'll also talk a little bit or study a little bit on the quality data reporting architecture. That also plays into your meaningful use modules, as does the Consolidated Clinical Document Architecture and the CCD TOC. If that's not enough alphabet soup for you, you're going to get more. Again, I'd like to stress that what we want to do in this section is to become familiar with these structures and these standards and how they're used and how they intermingle in places. And then be aware of how we can research them, where we can find more information and more specifics. These are going to be items that live on your desktop forever while you're working in health IT. And so familiarity will be important. But I need to tell you that the ones you're going to cover in this section are only a small portion of the various standards that are out there, but these are certainly the predominant and most used standards. While you're doing this, I would encourage you in your reading to take notes. A really useful exercise that I found as I was learning them was to kind of build a family tree out of them and show how they're related to each other just with lines and and dropping down, this is a subset of this, or when I'm using this particular standard, I'm going to need these definitional codes. Documents such as the CCD, the Continuity of Care document, will have LOINC codes in it. It'll also have ICD codes in it. It may have DSM-5 codes in it. Some of these are definitional standards, some are transport standards, some are the architecture, but they all do play together. Save up your questions for our discussion groups, or to go ahead and email me directly. I'll be happy to answer any questions I can. Again, this is meant to be an introduction to these tools, not necessarily a deep dive. But as we go on, you'll see how they all play into the other subjects we're going to cover: interoperability, meaningful use, data quality. So welcome to the standards. We're going to talk a little more in depth about the CCD, the Continuity of Care document, the TOC, the Transition of Care document. Why are we going to talk more about them? In the efforts to do meaningful use, these are very important documents. All certified, ONC certified EHRs can produce a CCD and consume a CCD. This was a major effort in developing the ONC certification standards. What does the CCD have in it? Well, a CCD carries most of the information you would see in a normal paper medical record. It's broken into sections. It's an XML document. Should have said that up front. It's extensible markup language. It's easy to work with. Has headers that break up the information quite nicely. It's human readable and machine readable. The sections in a CCD are advanced directives, alerts, encounters, family history, functional status, immunizations, medical equipment, medications, payers, a plan of care, the current problem, and a problem list, which we normally associate with diagnoses in layman's terms. Again, procedures, purpose, what was the purpose of the event, results, social history, and vital signs. It's a nice document to summarize not only a current episode of care, but give a historic perspective on care. The TOC, also an XML-based document, is about transitioning care. So you're in a hospital and I'm going to transition you back to your private provider. That's one form of transition. And it's going to contain the information that's necessary for your primary care physician to care for you after a hospital episode. But there are other TOC templates that for referrals. So I'm a doctor and I'm going to refer you to a specialist. This transition of care will give the specifics of what do I need you to look at, what's the pertinent history, and what information do I need to receive back from you as a specialist to continue the care for my patient. There's also transitions that are best suited for moving someone to long-term care, and other transitions that do occur. These documents are a little more specific to the nature of the transition than a CCD, where you're looking at the whole picture of a client as it relates to the episode or in their history. So as you're looking through your materials, and there's examples of TOCs and CCDs that are linked in your material, pay special attention to these two. Don't ignore the others, because again, in a CCD, you're going to see LOINC code, you're going to see SNOMED, you're going to see all kinds of different reference codes, you're going to need to know them. But these two documents are really tantamount to the success of meaningful use.